The HPV vaccine is the only vaccine that can prevent certain types of cancers. Now, HPV infections themselves are fairly common. I mean, there's a whole family of viruses called HPV that cause common warts and things like that. But there are certain strains of the virus that can cause serious cancers in women and in men. There have been 1,000 cases of cervical cancer associated with HPV occur every year in Ohio between 2008 and 2012. Nationally, there are thousands of cases each year of cervical cancer in women, almost all of which are related to HPV infection. There also have been several thousand cases of throat and mouth cancer in men, and about 60% of these have been associated with HPV infection. Additionally, thousands of cases of anal cancer occurring both in men and women, and about 90% of these have been associated with HPV infection. The vaccine protects young people against the strains that can cause cancer. It also protects them against strains of HPV that can cause viral warts in the genital area, which are painful and disfiguring. So the vaccine is very effective, greater than 99% effective at preventing these forms of cancer, as well as the genital warts. Side effects of the vaccine are very minimal. Swelling and redness at the injection site, and some kids may get a little dizzy or woozy during the vaccine process, so we watch them for about 15 minutes to make sure they don't pass out in the exam room. Another question I get asked about HPV vaccine is, why give it so early? My child isn't sexually active yet. And that's a great question. The important thing is the immunity is much better when we give this vaccine early. The immunity is not bad when we give it late, but however, the vaccine immunity is much higher. The antibody levels are much higher when we give it before age 13. I've had 2 daughters, and both of them have been immunized against HPV, and I feel good about that. If I had sons, I would also give them an HPV immunization. And if I have grandsons, I would encourage my daughters to give them HPV immunization. So don't delay. Get your child protected